Hi, I'm Rich Daly, and this is FastFinance, your quick hit of the news and numbers that matter the most in healthcare finance. Up first, weird numbers. 66%. That's the share of respondents to HFMA's Hospital of the Future survey who said healthcare's affordability challenge is a driving force for transformation. Now for today's main story. Health systems' adoption of artificial intelligence to improve productivity increasingly is meeting opposition from their own nursing staffs. Nurse opposition to AI has become most visible in nurse strikes, where limits and guardrails on AI deployment for clinical and administrative uses have emerged. 65% of hospitals reported using AI or predictive models integrated with their electronic health records in 2023. That was according to a recent study, but nurse distrust of the technology was seen in a 2024 National Nurses United survey that looked at 2,300 registered nurses and asked them what they thought about AI and found 60% did not trust their employers to prioritize patient safety when implementing the technology. Nurses were primarily concerned that AI tools were used for cost cutting. Industry advisors told FastFinance that AI concern by nurses increasingly shows up in union contract negotiations. So far, healthcare AI adoption has been driven by pilots, experiments, and efforts with little coordination. That's according to James Cervantes, a partner at Gerard, a strategic communications and change management firm.
The way I've been describing it is it's like a field of pilots and experiments and not a lot of coordinated efforts. And so I think there's a growing mistrust in AI and AI adoption. And also I think there's just a ton of hype around AI that I think folks are just generally skeptical of it.
The potential for AI-driven improvements was seen in research showing that registered nurses spend only 20 to 38% of their work time on direct patient care. Much of that imbalance was driven by the extensive data entry requirements of electronic health records. Cervantes said health system employees in general resist AI adoption because they don't necessarily trust the reasons the organization is doing it, or they don't believe that they've been considered in its design.
When we don't have that trust, when that trust isn't built between a healthcare leadership team or a manager and like the people that they're leading, it could be any technology and they might not be on board with it as good as it may be. So I think the first place to start and where we often begin the conversation with our clients is what does trust look like today with your strategy, with your AI tools, with your leaders, and how do we build from there?
Cervantes emphasized listening to staff to understand their pain points and talking to them about how the tool can help resolve those issues. Additionally, health systems need to personalize how the tool will make meaningful differences in their daily work lives.
From a nursing perspective, if we're implementing a new AI tool, I think the work we would do is ask the question, like, how does this make their shift better? Or how does it improve their day-to-day work? So instead of saying something like AI will improve workflow efficiency, which is, a pretty common term you might hear, we would push to make it more personable to them. So imagine leaving your shift on time or even a few minutes early because your documentation, which took you an hour to do, now takes you 15 minutes to do with this new AI tool, right?
So it sounds like health systems will need to take a considered approach in how they integrate potentially their biggest tool to improve productivity with the biggest part of their labor workforce. Now, before we go, just one more thing. Medicare payments for the 340B drug program and imaging services would incur notable reductions under CMS's 2027 proposed rule for the hospital outpatient prospective payment system and ambulatory surgical centers. Key provisions include a 2.4% base increase to Medicare payments in 2027, which would result in a 1.9% net increase for hospitals once all offsets are included. The biggest financial cuts would stem from increasing the 0.5% payment reduction for non-drug items and services up to 3% in 2027. That offset aims to accelerate repayments of a previous 340B related boost. The other biggest cost would require site-neutral payments for imaging without contrast services. That includes most MRIs. Although the rule limits the cut to fee-for-service Medicare, subsequent adoption by commercial payers could hit a major hospital margin driver. The rule also would cut the Part B payment rate for 340B drugs from average sales price plus 6% to average sales price minus 33.4%. However, budget neutrality rules would apply to that cut, so the savings would shift into the overall OPPS rates. Also notable are the 638 more procedures removed from the inpatient-only list, and that's part of a 3-year IPO phase-out. And the also notable is the 618 procedures added to the ASC covered procedures list. Well, that's all we've got for today. Don't forget, you can get the FastFinance newsletter delivered right to your inbox every Wednesday. Sign-up info is in the show notes below, or you can go to hfma.org. I'm Rich Daly. Thanks for listening.